or Beasley Media Group. Welcome to the Ask the Experts radio show, brought to you by Sunbelt Business Brokers Atlanta, selling Georgia-based businesses since 1998. Contact them today at 770-936-9099. Join us for the top local experts in fields of legal, health, financial, and home improvement. Now here is your host, Steve O.
Good morning, Atlanta, and welcome to another Ask the Expert show, where we bring you the top experts in the fields of health, legal, financial, and home improvement. We have my favorite show. As a host, I'm not supposed to say that, but I have never enjoyed doing a show so much as our next show. And I enjoy it so much. Not only do we do it once a month, but we do it twice a month with Dr. Taylor. Now, the reason why, and good morning to you, Dr. Taylor.
Good morning. Good morning.
It's so funny. Dr. Taylor has a practice in town, Taylor Medical Group, and they specialize in wellness and aesthetic therapies. He works in the areas of bioidentical hormones, weight loss, and he was an OB-GYN doctor, had a wonderful practice until he discovered anti-aging hormones, and he actually switched his practice over. And it's funny because we kind of discussed before the show the areas we want to talk about. And this morning, because of our last show we've had actually parents who've written us in wanting to know when we're going to talk about kids. Dr. Taylor writes me and said, we're going to talk about kids today. And we're going to also talk about where we left off with burnout. There was a lot of people at our last show that were really enjoying the conversation about burnout. And because we've been doing the show for adults for such a long period of time, we've had a lot of parents wanting to know when we're going to talk about kids, which we're going to do today. So, Dr. Taylor, tell everybody, I love your story about why you changed your practice, a successful practice in OB-GYN, and went into a completely different area.
Yeah. I've told the story before, but to be honest with you, it was a decision for self-survival and marriage survival.
I understand.
Yeah, so it was really had selfish motives, but it turned into a lifelong decision. Being an OBGYN, of course, I'm married to a woman. She's a doctor. And after about 7 or 8 years of practice, my wife started having, hormonal issues, difficult menstrual cycles and PMS, and, having trouble with her weight and things. And I did what I was doing for patients. I was giving birth control pills, and it wasn't really working for her. And then I had a patient who came in who was telling me about bioidentical hormones, or natural hormones is what they talked about then, and about salivary testing. And I thought that the patient was crazy, because I said, if this was really true, I would have learned it in my residency at Emory. But I decided to, my wife listened to a tape and asked me to listen to it. And it was by a guy named John Lee. And he was explaining bioidentical hormones and salivary testing. And my whole life changed after that. I started doing that with my wife, gave her some bioidentical progesterone, and all of her problems went away. Also treated some of my staff members who were menopausal, and all of a sudden their hot flashes went away. And since then, my life took a whole new direction, and I began to wonder, what else didn't I learn in medical school? And I found out that what I didn't learn in medical school is how to help people function properly throughout their lives. I learned how to diagnose and treat a true disease. But when people have functional problems, means their brain doesn't function or their reproductive system doesn't function, they don't have a disease, but they're not functioning well. And so now what I do is what we call functional medicine. What does the body need in order for it to function properly again? Just like your car. If you got a worn out spark plug, you can get to work and back, but your car will skip. It won't go as fast as it should. The ride will be bumpy or whatever. And if you don't put in the proper spark plug for your Chevrolet or Toyota or whatever, it'll get a little bit better, but it's not going to get all the way better. And eventually you're going to mess something else up in your car if you don't put that proper part in. So the body's the same way. If you put a drug in it that doesn't naturally belong to what the body uses, you're not going to get good function. And eventually you're going to mess up something else. That's why when you take one medication, you're going to need 2 or 3 more to offset the side effects of the first one. So anyway, so that's my story. So now I practice functional medicine. And again, my life is better. My wife's life is better. And I think my patient lives are better because I do something that a lot of other doctors don't do. There's plenty of doctors who can do who can give birth control pills and can do pap smears, but there's not a lot of doctors who are practicing functional medicine.
Dr. Taylor, are you trying to tell us you don't miss those 3 a.m. calls from labor and delivery that your patient
Yeah, that
is in
that
labor?
yeah, that's a young doctor's field. I did that for like 10 or 12 years. So yeah, I got too old for that. Yeah, when I first started doing it, was exhilarating. Oh, I'm going to the hospital, I'm doing a C-section, I'm doing this, and then I hit about 40, 45, and it took me 2 or 3 days to recover from a 3 o'clock delivery. So no, I don't miss it one bit. People ask me, do I miss delivering babies? No, I probably delivered about 4 or 5 thousand babies. That's enough for me.
You know what? I think God wanted you somewhere else. That's what it
Yeah.
was. Here's what is so amazing. I spoke to a friend of mine the other day, and I'm always bragging on you, Dr. Taylor. A male that wants to take care of his overweight problems. It used to be, I've been doing this for a long time, Dr. Taylor.
Mm-hmm.
It used to be most females that wanted to take care, of their weight, more female than male. But now, with health problems, whether it's heart problems or high blood pressure, whatever the case is, men are really starting to get into weight loss. So a friend of mine went to a doctor for weight loss only.
Mm-hmm.
He prescribed pills to him. That's not what you do. This doctor, and I told him, missed probably the most important thing is find out what's causing the weight problem.
Yeah.
And that's what you do.
Yeah. Yeah. I try to figure out again, let's talk about functional medicine. When your body is functioning normally, it's a lot easier to maintain your weight. A lot of times I would ask the guy, when did he lose control of his weight? And a lot of times it's stressful events. Maybe he got divorced, or maybe he lost his job and had some financial problems, or maybe it was at COVID where everybody was stressed and everybody gained 20 or 30 pounds. So that'd be the first thing I'd ask. The second thing I would ask is, what is his energy level like? A lot of people, because their cortisol is not correct, they have to eat
Yes.
carbohydrates in order to have enough energy to get through the day. And they'll have cravings that they can't control. And when you have a craving, you really can't control it. Your body is trying to get something that it's missing. And a lot of times it goes to the wrong place to get it, like Krispy Kreme or Dunkin' Donuts. It's the wrong place to get energy. And, I'd ask him what his libido is like. Maybe he has a testosterone problem that can cause him not to be able to control his weight. So yeah, you want to be able to get to the bottom of it. And once you fix that, it'll be a lot easier for him to lose the weight. And then when he loses it, that it doesn't rebound. That's why you get a lot of yo-yo dieting, because the basic underlying problem is not corrected. And whatever pills he gave him, he probably gave him an appetite suppressant or something like that. Once he stops it, he's going to gain the weight right back.
Exactly. So we are going to get to burnout today, and we're going to talk about kids today. But I wanted to bring that up, and Dr. Taylor will be back with us the end of this month again at 9 o'clock. Uh, so I want people to know that. But, we've got so many parents, Dr. Taylor, that their kids have adult problems, whether it's burnout or whatever the case may be. And you were starting to tell me a story about just yesterday about I guess, a son that went to Duke University,
Yeah.
had to drop out. Can you tell us about that?
Yeah, and this is not the first time that I've had a case like this. So the mother came in because she was having issues with weight and stress and whatever. So then one of her stressors were her son, who she said was at Duke, but she had to take him out, and she's been to the Mayo. She's been to 4 or 5 different places trying to see what's going on with him, and they diagnosed him with adult ADHD. And what I told her, I said, ADHD is not really a diagnosis. It's a description of his symptoms.
Uh,
Okay. It's attention deficit. So he has problems paying attention. So that's why he couldn't proceed in school, and hyperactivity. So it's not telling her why this has happened. So obviously, if he was able to get into Duke, his brain used to function. There's no way
yes.
you get into Duke and not have a functioning brain. So what made his brain not function? So I asked him, I said, I said, so what kind of student was he? Oh yeah, well, he played sports and he was in all these activities, and then he was, he was a straight A student and all that. So obviously he was functioning fine. So what happened? And I told her, I said, look, she was younger than me, but she was about my age. I'm in my early 60s. I said, when I used to come home from school, I did 30 minutes of homework, and then I went out and rode my bike for the rest of the day. I didn't have all these activities and things. So what I believe has happened with him, and this is how I would go about it. She's going to bring her son in because he's on all these medications. And I asked her, I said, is he any better? She said, no. So I was like, well, why are you still taking all
Still
these
doing the
medications?
medication.
Yeah, because it's just going to get worse. So here's what I think happens, and I've seen this before. One, your brain works off of these things called neurotransmitters, okay? And what that means is that they transmit messages from one nerve to another. So nerves, you can think of it like gigabytes or megabytes in your computer. If you don't have enough gigabytes, your processes are going to be slow. So these are neurotransmitters. And neurotransmitters come from proteins and amino acids. And you have excitatory neurotransmitters like epinephrine and adrenaline. And then you have non-excitatory neurotransmitters like serotonin, dopamine, and GABA. Everybody knows about serotonin
Yes.
because that's what antidepressants work towards, serotonin. So when you have amino acids that either have to make excitatory or non-excitatory neurotransmitters, your body's main goal is survival. So if it has a deficiency of amino acids, it's going to make more of the excitatory neurotransmitters because your body wants to make sure that you can survive. And it's going to make less of your parasympathetic or non-excitatory neurotransmitters. So what you have is you have all of this adrenaline that makes you not be able to focus. You're always looking around. You can't focus. And your non-excitatory neurotransmitters that tell you to calm down, everything's okay, those are diminished. So you get this lack of attention and lack of being able to process because your body is only focused on survival, the short term. Okay. So, and you can find that out with doing something called heart rate variability. Has anybody heard these? A lot of these athletes do it, but heart rate variability looks at how much your heart rate varies because it can measure how much excitatory and how much non-excitatory. So if you have low heart rate variability, it tells me that you have low amino acids and you have low parasympathetic activity. So that's one thing you can do. All right. The other thing is to look at his cortisol that we have been talking about. because she said he doesn't have any energy, has trouble
Right.
sleeping, all that stuff. So we look at his cortisol. And if his cortisol is low, we have to try and help build up his adrenal gland again, because your brain needs a lot of energy in order to function, the executive function. So I would look at trying to replace his amino acids, trying to get his adrenal gland to work with vitamin C, B5, B6, and NAD. NAD is the primary nutrient that you need to make energy, or ATP. So that would be how I would try and get his brain to function again, because it's not like the guy had a head injury. He wasn't in a car wreck
Right.
where he hit his head. He's not playing football where he's had got some concussion thing. He's just burnt out, because and you don't have to be burnt out from something bad happening. He's just burned out from being in all of these activities. And you got to think, this guy is 2021. He's on all these medications. He's been to all these people, and they've just thrown up their hands. And so the mother is stressed out, thinking that her son is going to be pretty much semi-disabled for the next 50 or 60 years. And that's stressful on her, and that's robbing this her son of his potential and his destiny. So I have seen this in kids as young as 12, 13, 14, that their parents have had to take them out of schools because their activity schedule was so jam-packed, and the pressure to make grades to get in
Right.
to get in the best private middle school and the best private high school, and then try to go to college, and the parents are stressed out because college tuition is $80,000, and they're like, I can't pay this. You got to make straight A's and take all these AP classes so you can get a scholarship, because I can't afford $80,000 a year. It is a lot of pressure in families now, and it causes early burnout in these families and in these kids and their parents.
You said that this this son went to Duke University, very, very fine school. You did your residency, I believe, at Emory.
Right.
Very, very fine school. And there's got to be so much pressure at these high-powered schools.
Yeah.
That and then there's things like, just the kid next to me's got Nikes and I can't afford $120 Nikes. The pressure is just, when it comes to kids. And I think you mentioned that this mother has taken her kids to other like Mayo Clinic.
Right.
But why are they not finding the source? It's like, Dr. Taylor, you are doing something different than a lot of other practices are.
Yeah. Well, the thing is that, again, when you go to traditional medicine, they are looking for diseases. Like I said, I'm sure he had CT scans. They're looking for all this stuff, but they're not looking at indications of poor function. So you get all of the disease labs and everything, and they show that he has no disease. That's right, but he has poor function. Everybody knows his brain's not functioning well. So why don't we try and measure his brain function and try and give back whatever he may have depleted himself of over the last 18 years of all of this pressure? And then, we're forgetting the other pressure that wasn't around when we were growing up is social media. So they see all of this stuff on social media, and the Kardashians and all the stuff that they do and have, and they think that that's how life is supposed to be. And then when life doesn't measure up to that, they feel that pressure, and you get depression and anxiety, because they're not measuring up to what they think the good life is, I guess.
We got to go to break. We're actually running late for a break, but I got to tell people that Dr. Taylor deals in anti-aging. And for the last 10 minutes, my mouth has dropped because I can see Dr. Taylor. And he just mentioned that he's in his 60s. Dr. Taylor, I thought you were in your 40s.
Man, I am 62 years old. I hate to say it, I am.
Well, you don't look like it. I was shocked when you said that. Let's give everybody your phone
Yeah.
number and especially your website.
Yeah. Okay. Yeah. My office phone number is 678-443-4000. 678-443-4000. And my office website is taylormedicalgroup.net. taylormedicalgroup.net.
Probably easier to make an appointment with you through the website.
Yeah, you can book online 24/7 on my website.
Let's go to break. When we come back, we'll have more with Dr. Eldred Taylor, Taylor Medical Group. We'll be right back.
Taylor MD Formulations was created by experienced, functional medicine physicians to fill a much-needed void in the nutritional supplement industry. Their mission is to design effective, multiple ingredient nutraceuticals which will increase compliance and improve clinical outcomes. Taylor MD Formulations manufacturing facilities follow good manufacturing practices and are US based and NSF certified. Taylor MD Formulations understands the important role that healthcare providers and pharmacists play in guiding patient care. Their products are designed to aid and support the body's overall health and functioning. Healthier bodies are less likely to develop chronic illnesses or show signs of premature aging. Taylor MD Formulations sets itself apart from the other nutraceutical companies because it was born out of many years of physician knowledge, clinical experience, and patient care. Their supplements are clinically proven, safe, and effective. Their cutting-edge formulations are designed to improve absorption, bioavailability, and effectiveness. At Taylor MD Formulations, they strive to provide the best supplements money can buy. To learn more or order products, go to www.taylormdformulations.com.
Welcome back to the Ask the Experts radio show, brought to you by Sunbelt Business Brokers Atlanta. Now here's your host, Steve O.
And we are back. This is the Ask the Expert show. I'm your host, Steve O. We're with you every Wednesday from 9 to 10 with Atlanta's top experts in the field of health, legal, financial, and home improvement. We are talking to Dr. Eldred Taylor today. He owns a practice called Taylor Medical Group, and they specialize in wellness and aesthetic therapies, holistic medicine, and we discuss weight loss on our show and bioidentical hormones and ED on our show. Today we're talking about kids. We're talking about stress. We're talking about burnout. Dr. Taylor, you almost have to be a psychiatrist in your practice.
Well, it helps. My wife's original training is in psychiatry. So she did psychiatry for about 7 or 8 years until we had our second child. And she was really burned out. She's the first person that I did a cortisol test on. I told when I used to go out and speak, I would say, God blessed me with a wife who had all the hormonal issues that I needed to study in order to have my practice. So she was burned out from a psychiatry practice, from juggling, trying to raise 2 kids and have a husband who's a doc. So she took 5 years off to raise our
recuperate.
Yeah, to recuperate. And that's when we kind of reinvented ourselves through that 5 years. And what she came to find out is that being a woman psychiatrist, she realized that a lot of her patients were these 40 to 55 to 60-year-old women who she was diagnosing as bipolar. And now she knows they really had a hormone issue. It was really a estrogen progesterone problem or a cortisol problem. So after that, we kind of went into practice together into this more holistic functional medicine. So yeah, and we do see some, actual psychiatry patients, and we try and treat them in a more holistic type way. Not saying that you get all of them off of medication, but a lot of times you can significantly decrease the meds that they're on and help them to function much better.
Yeah, we just had a listener contact us, and they want us to start really talking a lot about kids, because we have a lot of parents that listen to your show, and I think we can really start talking a little bit more about kids, because there is a problem out there. And I think some of the parents get frustrated, Dr. Taylor, because they're not seeing any results
Yeah.
from a pediatrician or the type doctor they're seeing. And I think you just have a different way of going about things, that I'm just going to say this. If what you're doing is not working, why not try something different?
Yeah. And most of the time, if somebody's not in the functional medicine mind from the beginning, a lot of times I see patients after they, like the patient yesterday who she's taking her kids to all these other places. A lot of times I'm usually the last resort. They are frustrated with the conventional medicine system, and then they come to me. Now, to be honest with you, I don't mind that, because when they come to me and they've been to all those docs, the docs have ruled out all of the major diseases. So I know I'm not missing anything major. So now I can totally focus on functional medicine.
Well, you know what? I just looked at our clock, and
yeah, I know we're getting short on time.
Well, you know what? It's one of those shows that it's like a good book. You just you just want more, and we're going to give everybody more. And you're going to be on the last Wednesday of this month. Again, let's tell people how they can get a hold of you.
The website is taylormedicalgroup.net, and the phone number is 678-443-4000. 678-443-4000. But again, the website is the best place, because we have a lot of educational information on that website, and you can also book an appointment.
Great. Well, thank you so much. Listen, have a wonderful Christmas, Dr. Taylor. We love you here at Ask the Experts and appreciate you so much. We're going to go to break, and when we come back, we've got our Sunbelt Business Broker Show. Again, thank you so much, Dr. Taylor.
Right. Thank you. All right, and happy holidays to everyone.
Same to you.
All right, bye-bye.
Taylor MD Formulations was created by experienced functional medicine physicians to fill a much-needed void in the nutritional supplement industry. Their mission is to design effective, multiple ingredient nutraceuticals which will increase compliance and improve clinical outcomes. Taylor MD Formulations manufacturing facilities follow good manufacturing practices and are US based and NSF certified. Taylor MD Formulations understands the important role that healthcare providers and pharmacists play in guiding patient care, designed to aid and support the body's overall health and function. Healthier bodies are less likely to develop chronic illnesses or show signs of premature aging. Taylor MD Formulations sets itself apart from the other nutraceutical companies because it was born out of many years of physician knowledge, clinical experience, and patient care. Their supplements are clinically proven, safe, and effective. Their cutting-edge formulas are designed to improve absorption, bioavailability, and effectiveness. At Taylor MD Formulations, they strive to provide the best supplements money can buy. To learn more or order products, go to www.taylormdformulations.com.